Hello good people, it's your girl Eva Musioki, a graduate from the University of Nairobi, currently taking my diploma in nursing. For the returning subscribers, asanteni sana. If you've not subscribed, please subscribe to my channel, support a student nurse, and please feel free to like, comment, share, and follow my content. So today I'm going to talk about diabetes, because most of you were saying that I should talk about a condition that affects both men and women, because the last video I talked about danger signs in pregnancy. So I'm going to talk about the different types of diabetes, the signs and symptoms, and how you can manage diabetes. So the types of diabetes include gestational diabetes. This mostly occurs to pregnant women, mostly between 24 to 28 weeks of pregnancy. This type of diabetes usually occurs because of changes in placental hormones, and it's important, if you realize you're swelling either on the face or on the legs, it's important that you go get checked, because gestational diabetes usually affects the infant. The second type of diabetes is type 1 diabetes. It's also called juvenile diabetes. It's called juvenile diabetes because it affects people from 13 to 30 years of age. Then the third type is type 2 diabetes, usually affecting above 40 years. So for the signs and symptoms of diabetes, how do you know you have diabetes? For the first sign, if you realize you have increased urination, you're going to the washrooms for more frequently than you used to go before, it's important you go to the hospital and get checked. The second sign and symptom of diabetes is increased hunger. If you realize you're having hunger most of the time, it's important that you go to the hospital and get tested for diabetes. The other sign and symptom of diabetes is fatigue. If you realize you're having general body fatigue, it's important that you come to the hospital, you get tested for diabetes. Another sign and symptom of diabetes that most of you complain of after diabetes after you've already been diagnosed with diabetes, prolonged healing. Most people, they don't realize they have diabetes until when they have a wound that takes so long to heal. So another sign of diabetes is prolonged wound healing. So I'm going to talk about how do you manage diabetes, and how do you get tested for diabetes. To get tested for diabetes, we usually, the common test, there's the fasting blood sugars and the random blood sugars. Random blood sugars, it's usually done after you've taken a meal. For the fasting blood sugars, it's done early in the morning before you've taken any meal. For the ranges, for the fasting blood sugars, they should be between less than 7. For the random blood sugars, they should be less than 11. They should not be more than 11. And how do you manage diabetes? If you realize you have diabetes, it's not a death sentence. So how do you manage? Mostly, we usually use the nutritional therapy, self-monitoring for diabetes, exercise. Yeah, for exercise, it's important. If you realize you have diabetes, it's important to engage in diabetes, and we usually encourage, for the patients of diabetes, you should not exercise immediately after you've injected insulin. For nutritional therapy, for a diabetic plate, we should ensure half of the plate for diabetic patient, it should be vegetables, and the other half should be proteins and carbohydrates. For self-monitoring of diabetes, it's important you know how you can monitor your glucose levels, and you should, anytime you've taken insulin, your sugars can go to to a lower level. That's what we call hypoglycemia. So it's important for diabetic patients. It's important anytime you sorry for that. It's important to ensure you have any type of simple sugar, maybe sweet, just in case